So from the previous video, we spoke about the needles, but now we have to combine the needles, how we use the right technique to inject the insulin. Because I've seen a few videos which I'm going to share with you. I've seen them on the internet. I'm going to talk about this in a second because, of course, now we have the Professor Saqib Mahmoud with me, which I can ask him about the right technique because that's a very important topic. Hello again. How are you?
I'm fine. Good.
So, as I've seen on the internet, let's say this is our skin and that's the pen.
Put the needle on.
Okay, let's put the needle, of course. So let's twist that needle in. So we're gonna show you what I've seen. I mean, and we can discuss that important topic. We're pretending now I'm not gonna use proper needle just for
It's a demo pen anyway.
Demo anyway.
Well, take the plastic cover off.
Okay, so this is our needle. Let's say that's
and it's the correct size.
Yeah,
4
4 millimeter. Just let's remember that from the previous video, 4 millimeters. So I've seen some videos like people are quenching the skin like this and going into a 45 degrees angle. And I'm going to share those videos as well, those photos with you. So what do you think this technique, which we've seen on the videos and on photos, what do you think about the right technique?
Totally wrong. Totally
See,
wrong.
it's totally wrong. Do not pinch your skin like that and go 45 degrees angle.
Totally
it's
wrong.
Totally wrong.
Yes.
So now we're going to learn about the right technique that you have to follow. So this is the pen.
This all started when people used to use the conventional syringe and needles, and then they had to do an angulation like we still do with the other injection. But now we have a pen and we have the correct size needle. So there's no need to kind of angulate the injection, and it has to be perpendicular to the skin surface. So perpendicular means that it has to be right angle. So if this is the skin, so you don't go like that, you don't go at any angle, you go straight into the skin just like that, and then you inject your insulin. The other thing is that a lot of people have been told and explained that you need to pinch the skin. You do not pinch the skin. What you do is with your two fingers, you just simply separate the skin. Separate the skin with one hand. So you stretch it out, and then it kind of looks like that it's been pinched, but it's just being separated and stretched, because
so we go like
it's important, because a lot of people will have thin skin, and they have skin laxity, and the skin will fold up. So just to avoid that, so that you don't inject in the wrong place, and you make sure that it goes into subcutaneous tissue, so you need to stretch it like that across the abdomen or wherever. If the skin is quite tense, then you don't need to do that, but this is for the abdomen. And then you stretch it, and then again go straight into that right angle, not at an angle anywhere, but straight into right angle.
So if we turn it like this side to show.
So on the side, it will look like that.
So they can see it on the side, yeah.
And then just go straight in.
Yes.
Straight in like that, okay? Right.
So that's very important, because I've seen different technique, different photos on the internet. We need to make the right insertion of insulin, which thank you very much, you did explain it to us. One more question.
Yes.
I remembered now. So people were asking how to put it in the different size. Where do they inject? How do they circulate the injections?
Oh yes. Okay. Great.
Yeah, because I know people might not know how to put it, where to put it, where to circulate.
So remember that site rotation is very important for many reasons, because if you don't rotate the site and you keep injecting insulin in one place, especially in the soft tissue, in the fatty tissue, it will have reactions. And insulin is a biological active product. It will cause changes inside the fatty tissue, and it will create into lumps. In order to avoid those lumps, which are called lipohypertrophy, we need to ensure to the patient and explain to them clearly that never inject in the same place. So there are many good ways of doing that. One of them is to tell the patient, divide your abdomen, if you're doing it on the abdomen, into a clock, and change it every time you inject, and you rotate. You can do 1/4 and finish the whole thing, then do the second quarter, divide into 4 quarters and do that. Or there are some things called injection grids, which are available, and a lot of pharmaceutical industries provide this free of cost, where you get the needles, and one of them is this. You can see what you can see here in the center. It says belly button, that circle. So that fits onto the belly button, and then you have these little holes here, like little cutout holes. So for example, patient starts off with that like a template and injects over here. So what they do is they take one of these out, and then they inject on here. Then they have to inject tomorrow or later on, then they take another hole out and they put the same cutout and do that. So you see what's happening? It's one finger breadth away and it's not in the same place. So they ensure that the site is not being reused in a very short time. After like a little while, they can come back to these places, but not very quickly. So this is a correct way of developing a technique, and they don't have to use this cutout template all the time. It's when they first initiate or they haven't been told, then it's useful. You can make it or you can get it from any of these companies which provide these needles, and they give it free of cost. It's called the injection grids. So you use that to ensure that it's not injected in the same place, and you rotate it. So what you do is you finish one quadrant and you go into the second one, or you can go in a clockwise manner and keep coming back towards the internal place. So you can inject in all these areas. And if they are on basal bolus insulin, which is they are got basal insulin and short acting, then they have quite a few injections to do, like 4 injections. And then you can say to them that inject your short acting in the tummy, and then another grade, which is this one, and you can use that at the back of the arm, or better still is on the side of the thighs. So I really recommend this one on the side of the thighs, and then do the same thing, that you do not reuse the same area where you've injected. So this is how you ensure that the insulin sites are rotated appropriately as recommended. But without even this, you can just say to the patient that use one finger width, so one finger breadth away from the previous site. So they just decide that themselves and do that. But important thing is to ask them to rotate. Otherwise, some patients who are not informed, they'll keep injecting in one area, and very often they will end up injecting in the same place, and that will cause problems. The other thing which is very, very, very important, and you just write it down, give it to patient: never ever reuse the needle. It is completely forbidden that to reuse the needle. You should use the needle only single time, once only, and that's it, and then get rid of the needle.
We're going to talk about that in the next video.
Yeah.
We keep it for them to get started. Why you shouldn't be using the needle again and again, and you have to change it, because that's a very, very, very important topic, and we're going to mention in the second video. So keep tuned for the second video to know more about why not to use the needles again. Thank you.